Good morning, everybody. I hope you're all doing fantastic. So on today's Wellness Wednesday, we are going to talk about chronic fatigue and hyperbaric oxygen therapy, or HBOT. So the CDC estimates there are approximately 1 million people to 17 million people in the United States that suffer from chronic fatigue. Chronic fatigue syndrome is a rather debilitating condition which is characterized by fatigue on minimal exertion accompanied with a range of other symptoms. This type of fatigue is not one that generally goes away after a period of rest. A lot of times the fatigue is accompanied by headaches, sleep disturbances, so the inability to get to sleep or the ability to have restful sleep, cognitive difficulties, and muscular pain. The severity of this condition varies widely from person to person. Currently, there's no cure for chronic fatigue syndrome, or CFS as it's commonly known, and treatment is only focused at reducing the symptoms. And as always with hyperbaric oxygen therapy, the benefits, once you've gained them, you get to keep them because it's making an actual physical change. I always like to remind people of that. And HBOT is a natural and effective, safe option for those suffering from CFS. Many autoimmune conditions have no cure, so it's important to remember that. And treatment is aimed at reducing your symptoms. So a number of neurological conditions are reduced with HBOT. It helps decrease neuroinflammation, reduces chronic fatigue, helps reduce chronic headaches, moderates insomnia. It can help enhance short-term memory, concentration, and helps lessen depression. Maybe we should do a video on that one. Some of the effects of hyperbaric oxygen therapy, HBOT: improved attention span, enhanced concentration, enhanced executive function, so higher level thinking, increased memory, enhanced processing speed, and improved brain blood flow. Pretty great. It will also help increase the quality of a person's life. Pretty darn cool. So here are a couple studies. I will try to get them to post. Sometimes Facebook's ornery. Here's one from the Journal of Chronic Fatigue Syndrome, Volume 11, Issue 3 from 2003. HBOT was able to show an immediate effect on the relief of cellular hypoxia. So the cells are not getting enough energy, enough oxygen in this case, which is a feature of chronic fatigue syndrome. The participants underwent 60 minutes of treatment every day for 5 days, followed by weekly treatment, which seems to resolve them completely. What? Pretty darn cool. Another one, they were looking at the efficacy of HBOT in the management of chronic fatigue. Patients received 15 treatments over a period of 3 weeks, so 5-day week treatment for 3 weeks. The outcome assessments were used before and after and revealed a decrease in the severity of symptoms and an increase of quality of life across the board, regardless of the severity of their initial symptoms. So if you guys and gals know someone that has chronic fatigue, share this video with them or send them our way, and we would be more than happy to chat with them and see if it's a good fit for them to get started. Have a great day, P.L.L.C. See ya.